This is Abaia COVID-19 update. Abaia COVID-19 update. For the first time in 5 months, Nigeria recorded less than 1,000 new COVID-19 infections in a week between Sunday and Saturday. That's September 13 and 19. The country reported 968 new cases, which is a 23% reduction from the 1,272 recorded the previous week, the 38th week of the pandemic in Nigeria. Those are according to the data sourced from the Nigeria Center for Disease Control. The last time Nigeria recorded a lower weekly figure was the 641 cases recorded between April 19 and May 25. Last week's record appears to be an indication that the country is gradually overcoming the pandemic, particularly with the fact that the reduction occurred despite the increase in the number of tests. A total of 31,943 samples were collected for testing last week. That's against the 16,035 tested the previous week, a 50% increase. Also, Nigeria has recorded less than 2,000 new cases in each of the past 4 weeks, and nevertheless, the Presidential Task Force on COVID-19 and the NCDC, that's the Nigeria Center for Disease Control, have continued to encourage adherence to safety guidelines. Many Nigerian states have reopened schools, while local and international travels have also resumed at the airport. These can lead to a rise in cases if safety protocols are not complied with. Meanwhile, the World Health Organization is advising countries not to relent in putting necessary measures in place. This is Abia State COVID-19 update, the first edition for the week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19 as well as the state governor's efforts, Dr. Okezie Ikpeazu, in ensuring that the state is safe from the virus. This program is running simultaneously every weekday, Mondays through Fridays on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Let me bring you up to date on the figures and the updates globally now. There are over 31 million confirmed cases of coronavirus globally, with over 22 million recoveries, and 965,194 persons have died due to coronavirus. Now, cases in Britain are on the increase in what Boris Johnson has labeled a second wave of the virus, with large areas of the country subject to restrictions on social freedom, and London expected to be next in line. The UK reported 3,899 new cases yesterday after a 4-month high of 4,422. That was on Sunday. And of course, thousands of demonstrators calling for Benjamin Netanyahu's resignation gathered in Jerusalem, despite the Israeli national lockdown that went into force Friday. I told you last week that authorities in Israel, which has seen one of the world's highest per capita rates of coronavirus infections in the past 2 weeks, imposed a new nationwide lockdown. That was on Friday due to second wave of the virus. United States performed a record 1 million tests on Saturday. 1 million tests a day. But experts say the country needs to be hitting target of between 6 to 10 million a day to get the outbreak under control. And of course, India's coronavirus case tally surged to 5.4 million as it added 92,605 new infections in the last 24 hours. The country has posted the highest single-day caseload in the world since early August and lags behind only the United States, which has 6.7 million cases in terms of total infections. Now let's bring it back home in Nigeria. Nigeria recorded 97 coronavirus infections yesterday, a sharp decrease from the 221 and the 189 cases reported on Friday and Saturday respectively. This latest figure, that's the 91 coronavirus infections, one of the lowest in at least 6 months, was recorded in just 12 states, bringing the total number of infections in the country to 57,000 242. The new cases were found in Lagos with 46, Kwara State with 12, Rivers State with 11, Adamawa State with 4, Niger State also 4, Ogun State also 4, Osun State with 4, Ekiti State with 3, Imo State with 3, Kaduna State with 3, Plateau State with 2, and the Federal Capital Territory with 1. And since late July, that's the ending of July, Nigeria has not reported a daily infection figure that was above 500. An indication that the country might have passed the worst stage of the pandemic. According to the update, if you've been following the figures, about 48,569 of the over 57,000 infected persons have recovered and been discharged after treatment across the country's 36 states and the Federal Capital Territory, Abuja. Only about 7,500 infections are still active in the country, one of the lowest in the past 3 months, indicating that the epidemiological curve is falling in the country. The death toll from the virus is now 1,098, meaning 1,098 people have died of coronavirus complications in Nigeria. That's after 3 people succumbed to the disease rather, in the last 24 hours. Let me bring you up to date concerning, I'm going to analyze the current COVID-19 result in Abaia State, but let me bring you up to date concerning the health sector. You know, the joint health sector unions and the Assembly of Healthcare Professionals, JOHESU, they went on strike last week. They've suspended the strike, the 7-day-old warning strike, and they made the decision following a meeting of the union's National Executive Council, which was held yesterday. According to a statement signed by JOHESU's national chairman, Bioblemoye Josiah, the union said it's decided to suspend the strike not because its demands have been resolved by the government, but to sustain the running of Nigeria's public health systems. Of course, JOHESU is the group of other health workers except for doctors. They embarked on the 7-day warning strike last Monday following the inability of the government to meet its demands, which included non-payment of hazard allowances. Now let's go straight to what we have for you this morning on Abaia State COVID-19 update. Last week, the governor of the state, Dr. Okezie Ikpeazu, commissioned new molecular laboratory in Aba, at the Infectious Disease Hospital in Aba, and of course we will be looking at that this morning. A molecular laboratory and a diagnostic center in Aba for the testing of COVID-19, and an infectious disease hospital which has a capacity to isolate and treat 50% of COVID-19 and other infectious diseases at the same time. We have Professor Sam Erugo of Abaia Development Summit, a non-political organization that assisted in the realization of this project, joining us this morning. Professor, good morning to you. Oh, it seems I have issues with the connection. Hello, Professor. Good morning to you.
Good morning.
Oh, great to have you join us. You're live on Abaia State COVID-19 update, and it's a simulcast on several radio stations in the state. Now, we want to know about the involvement of your group, the Abaia Development Summit, in delivering this edifice.
Thank you. Well, you realize that COVID-19 got the world shut down sometime from March this year, and a view of the development strides of performing governor, we thought it wise that Abaia citizens from all walks of life should be able to contribute and support the governor and his government in facing the pandemic. And we got together and formed the Abaia Development Summit, which by the grace of God today is a registered non-governmental organization. And we raised funds, saw the governor's support, first by giving us a space, which happened to be at the General Hospital in Aba, the construction of the purpose-built molecular laboratory. We started sometime in May, even during the pandemic we were working. And by the grace of God, we were able to realize that building that you saw that day. And the governor was gracious enough to donate the machines that enabled the commissioning. So what we have today is a molecular laboratory built in partnership with Abia State government. We remain grateful to the governor for all the support.
Okay, in specifics now, Professor Erugo, we want to know what is the involvement of the organization, the Abaia Development Summit, in realization of this edifice. What exactly are the things that you contributed to achieve this feat?
Well, I can say we contributed the buildings, the construction that you see in that premises is a contribution, and of course, organizing the molecular laboratory issue. So the government contributed all the equipment that you see there, and we are grateful. Of course, we are ready to provide the equipment. The government intervened and said he had to support, and provided the equipment. So we did the construction, we organized everything. And we are looking at having a better facility there in future, not just for testing, but also for treatment.
Oh, great. So how can it help in the fight against COVID-19 in Abia State?
Of course, the simple answer is that, you know that most people dying because of the pandemic, the COVID-19 pandemic, they die because there is nowhere to run a test and be sure of their
early testing.
Yes, so early testing is critical. In the Abaia area, it looks like that's the only one now in Aba, and you can see the huge population of Enyimba city. Yeah, so when network news every day, they report about the number of cases identified, you begin to wonder whether people in Aba have been tested. Knowing fully that Aba is the largest commercial city in Abia State, you know what that means. And it turns out that the governor provided one of the best testing equipment that can test as many as you can in a day. One of the best in Nigeria. It's not just 6, it can test up to 20 randomly at the same time and be able to send the result to the NCDC center.
That's the dashboard of the Nigeria Center for Disease Control.
Yes.
Interesting. So what do you make of the strategies adopted by the governor in containing the spread of COVID-19 in Abia State?
It has been fantastic. You can see the governor in his usual way partnering with every group available, not just relying on what government can do. Government alone cannot solve these problems. As we speak today, I think we have up to 4 testing centers in Abia State. And you see the governor participating in all of them. That's what governments should be. Government alone cannot provide everything we need, which is why the Development Summit thought it necessary to bring all Abians together from all walks of life, non-partisan, running across party line to support in this one. So it's been fantastic.
Interesting. I want to know more. I believe Abians will want to know more about Abaia Development Summit. Some persons might be hearing that for the first time, and a non-political organization coming up with such brilliant idea, partnering with the government to provide an edifice that will house COVID-19 equipment, of course, at the IDH in Aba. We want to know more about that non-political organization.
Well, Abaia Development Summit, one can say, is one of those things you can say as a positive, comes from the positive perspective of COVID-19 pandemic. You know, whenever there is a crisis anywhere in the world, people think about the negative aspects only. But there is always a positive dimension to every conflict. So I think Abaia Development Summit is one of those positives. It's a pity that people had to die out of this pandemic. But assuming we had facilities like this before now, probably the story would have been different. At least I know some people that died in Abia State because the doctors refused to treat them. because they were thinking they were COVID-19 cases. And it turned out that when the result came out, they were positive COVID-19 negative. So if we have this kind of centers, the Abaia Development Summit has always to provide, we won't be having these issues. So the summit is open to every Abaian that wants to develop this state, partnering with the government. So we're open for membership. If you know you can contribute, not just in cash, even in advice, professional advice. So you find out that we have medical doctors, we have politicians, we have, interestingly, most Abaia citizens at the National Assembly contributed to this fund. They are part and parcel of this summit. You have professionals, you have the academia, you have businessmen, all of them coming together. The advantage of what we are doing in Abaia Development Summit is that it's not partisan. No party will say this is our own. We want to work with our government. This is our government. We have no other government except this. Abaia is our own, and we need to support our governor. We see the governor performing without talking too much. He believes in action, not talking too much. So ours is a contribution towards assisting government in providing the best medical facilities we can have in Abaia State. So we want to partner with organizations like our own. We want to draw from every aspect of Abaia life. Let citizens come together. Let's support this government to give Abaia the best. Thank you.
Okay, we also want to know, how did you get the funding for this particular project?
Contribution from members, of course. No external funding. Contributions by members.
A lot must have gone into that project, Professor.
Yes.
Like how much?
Several millions.
Hundreds of millions?
No, not yet.
Okay.
Of course, you know that the government donated the land. So we can say that the cost of land is not there. So I'm sure we spent roughly 30 million naira in that project.
Oh, that's it. That's a lot. 30 million.
Yeah.
All right. Hopefully, we will be getting more projects from the organization
course, yes.
to help move Abaia State better. Or you have something in the pipeline?
Yeah, we want to upgrade that place. Luckily, the equipment at that side now can also do run other tests. So we are going to improve on the capacity of that place to diagnose other illnesses that are bound. Then think of a full-fledged medical facility where people will not just be tested, they will also receive treatment. That's where we're heading to.
Oh, interesting.
By the grace of God, I think we'll survive.
All right. We want to appreciate your time on the program this morning, Professor Sam Erugo of the Abaia Development Summit, a non-political organization. Of course, thank you very much on behalf of Abaians. We want to say thank you very much for helping in realizing that project, of course, in the fight against COVID-19 in Abaia State.
Thank you, my brother, and thanks for spreading the gospel.
All right. You're welcome.
Thank you.
You're welcome, Professor. All right. That Professor, you heard him. That edifice was commissioned last week by the governor, Dr. Okezie Ikpeazu. And of course, the premises at the premises of the Abaia General Hospital, location of the 16-module gene expert laboratory, the governor commended the patriotic zeal of members of the Abaia Development Summit who constructed and donated the building which the state government equipped. And the governor expressed joy that the facility was built by a coalition of private sector persons from Abaia State, while the Abaia State government supplied the medical equipment for the center, adding that it would complement the laboratories already in place at the Abaia State Specialist Hospital and Diagnostic Center. That's at Amachara. Well, the Commissioner for Health was also present, Dr. Joe Osuji, who thanked the governor for the project, saying that the state brand new laboratory, Abaia State, has no business taking samples outside the state for testing, and informed that the state is surely the one or only one in the southeast region, and probably the only one in Nigeria that has deployed the 16 modular gene expert equipment which was procured from the United States of America. And now let's look at the analysis. I told you that I will be analyzing the current COVID-19 figures in Abia State. 823 samples result reported, 46 positive, 774 returned negative, and 3 inconclusive. And till date, the total till date, we have 7,341 samples collected with 881 positive cases in Abia State. Of course, the total discharged using the NCDC discharged criteria is as 847, and the number of persons that have died, we have 8 in Abia State. We need to let you know that most of the reported deaths happened before the test results came out, and of course we have 26 active cases. Anyways, more persons might have been discharged because the figures were captured as of Saturday, I believe. Okay, and of course you need to know that Abia State is the highest testing state, and indeed the highest nationally in the month of August and possibly September so far. Testing is key to breaking the chain of transmission, you know that, and we have the state has established sample collection points in 14 local government areas, while the remaining 3 will be established today, of course, before the end of the week. And contact tracers have been trained and deployed in all the local government areas of the state. And the state also has the isolation facilities in Aba. You heard the latest one, of course, that's one built by Abia State Development Summit, the non-political organization, and also in Umuahia at the Amachara, with only about 20% of the capacity used so far. And of course, the state is currently the highest testing, have the highest testing capacity in the entire southeast region. 1 gene expert machine and 1 PCR equipment in Amachara Specialist Hospital in Umuahia, while another 16 modular gene expert equipment which has been installed in Aba. And Abia State is the only state with a 16 module gene expert equipment in this region. All right. Tomorrow we will be back to bring you up to speed on what is happening concerning COVID-19 in Abia State. Many thanks to the partner radio stations BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. My name is Michael Oni. Stay safe and take responsibility. Abia COVID-19 update.